Today's nursing profession is so much more than just another job. It's a career that encompasses science, technology, research, evidence-based nursing care, patient advocacy, and interdisciplinary leadership. The California State University system provides nursing students with both the latest knowledge and optimal skill-based learning opportunities that are essential for quality patient care.
CSU Nursing graduates come out the door with this confidence. They've been instilled with this knowledge. They understand the rationales behind what they're doing, and that makes all the difference when they go to apply it.
With the help of the CSU system, I can look at someone and see the texture of their hair and know that something might be wrong with their thyroid.
I just love SimLab, and I think that's a really great opportunity for students to have, because they're put in roles where they're the primary nurse, where they're the charge nurse.
They can actually put, blood flowing through the veins of these mannequins when you're practicing IVs.
Within 3 years, this program was able to prepare me to transition into the medical field and be very proficient at my job.
They're adapting to the technology that's already in the hospitals. They have the same equipment.
The CSU nursing programs are very specific about evidence-based practice. And of course, evidence-based means the research has been done, and so we know what the best practices are.
Promoting diversity in career options within the nursing profession is a hallmark of the California State University. From an academic standpoint, there are multiple levels of achievement and fulfillment attainable. The opportunities begin with a Bachelor of Science in Nursing, or BSN, and continue through a Master of Science in Nursing, or MSN, and terminate with a Doctor of Nursing Practice, or DNP, which is one of only a few independent doctoral programs in the CSU.
The Institute of Medicine is clear about the fact that the future is dependent upon practicing at a minimum of a bachelor's degree. There's research that shows the patient's care is safer when the nursing workforce is better educated.
I've been in this business for 30 years, and it's about time that nursing is achieving parity with my colleagues. The degree of responsibility that I have in taking care of patients in a primary care setting warrants me to have the best education and the highest level of education that is achievable, which is the doctoral degree.
I love my instructors. They are some of the most beautiful people I ever met.
We are a small community in terms of being able to get together very often, regularly, to discuss ways to enhance our teaching.
Nursing today is a high-energy profession, requiring flexibility and significant levels of autonomy and decision-making. Often, nurses are patient advocates, team builders, and champions of excellence in quality health care, reaching out to vulnerable populations.
The nurse has got to be able to understand and listen well to families, because often what we are hearing from them adds to the richness of the assessment and the clinical intervention. And that really does come from nurses learning how to think.
One of the big focuses of the CSU is community involvement. And it's typified in our student projects. They get out into the community and work with the vulnerable.
Teaching is a big part of nursing, and nursing is a big part of primary prevention. A lot of the diseases that people are dying from are mainly things that we can prevent.
I want to improve healthcare for populations of color. It would be my interest at some point to do research on those populations and how they experience healthcare.
Physicians are not going into primary care any longer. A nurse practitioner in my position is in an excellent position to take over that type of care.
We are a huge force, but we are the most trusted profession. We know we have to evolve and change, and never think this is where you're being prepared as your endpoint. This is your beginning point.
Nurses are licensed to be independent, but our practice is teamwork.
The California State University is the leader in preparing nursing graduates for the complexities of the workforce. The CSU's faculty, staff, and students are champions of nursing excellence and the innovators of quality practices that result in high-quality patient care.